the Berlin folks weren't able to make it. But we've got PTs representing all of our clinics here, including future colleagues of ours from Wisconsin Blood and Joints Mayfair PT Clinic. So welcome. You guys kind of get to know these folks a little bit later. But thanks for coming. And also thanks to Jonathan for coming. This is Jonathan Ferris. I'll let him kind of, I'm trying not to steal too much of your thunder, but Jonathan's from Orthotech, a local orthotics fabricator. He's got a ton more that he does, and he'll tell you all about that. But our goal here is to introduce Jonathan and his process and his product and how we are going to be working with Jonathan. So that's including capabilities of the product, an order form, and also the actual process of capturing foot casting for his use. So without further ado, Jonathan Ferris.
Thanks, Cal. Maybe you can hand out the order forms, just
Yes.
so everybody has one when I'm going over it,
Yes.
that everyone can kind of look at it.
There was a pile back there. Some of you might have grabbed it, but I will be going to pass some of those.
Thank you. I can get started. Hey everyone, thanks for coming. Good to see y'all. Again, my name is Jonathan Ferris. I'm an acupuncturist and a podorthist. My company is Orthotech, as Cal said. I've been in practice for over 20 years total. Here's our agenda today. We're going to go over the technology that I use to make orthotics, get you comfortable with the order form, everything on there, to make sure that we make everything how you guys want it, and then the foam box training. So getting comfortable with making a cast in the biofoam to capture a good image of the foot to use. So again, I've been practicing for 20 years as an acupuncturist. My focus with acupuncture has always been orthopedics and sports medicine. I've been, the last 12 years, also a podorthist. And my company, Orthotech, has been around for about 25 years. I mentored with a gentleman called Dane LaFonce, who is the founder of Orthotech. And he was one of the premier podorthists in the country, especially focused on sports medicine and orthopedic orthotics. And I had the privilege to train with Dane for a couple of years, and then purchase his business, Orthotech, and have integrated now the orthotics with my acupuncture practice the last 12 years. I am on the medical staff for the Milwaukee Brewers. I have spent 5 years with the team as an acupuncturist, doing some travel and working with the players. I no longer do that, but I am still on staff as their podorthist, making orthotics for the team, as well as the Marquette athletics program at the university. So I make all the orthotics for the sports teams at Marquette University, including our great basketball team that we've had the last couple of years, and our awesome new coach, Shaka, who's amazing. Just a couple pictures of my family and I. I'm married, have 2 boys, love baseball, like doing outdoorsy stuff. A lot of time with the family and kids when I'm not working, so it's a little about me. This was a random quote that this slideshow generated, but I really liked it. Recognizing the need is the primary condition for design, right? So basically, treat what you see, right? Kind of analyze the patient, see what's going on with the biomechanics, and then try to adjust and accommodate for what you're seeing as a trained clinician. So I want to include a little bit about how orthotics function. There has been some evolution in the theory over the last few decades. The main thing orthotics are doing, as far as the biomechanics are concerned, is you're changing the angle and direction of force through the subtalar joint. I know you guys understand this, but I did want to emphasize it because that's really what orthotics are doing. You're not necessarily holding the foot in neutral, you're not forcing anything too extreme, but we're just kind of analyzing the direction of force through that subtalar joint and altering how that force is being translated through the subtalar joint to help better, help the feet function better and the alignment and structure work to its optimal. So honestly, most of the research on this, I could supply some of the studies. Really, it's a small amount, to be honest. Like they're like maybe a degree and a half on the research of how much you can change that. But that even smaller, amounts of change in that force direction can really impact the person's feet and their function. as well as other, alignment issues, up the chain, knee, hip, back, that kind of thing. The other main function for orthotics are cushioning, some shock absorption, qualities to them. Offloading certain areas, obviously, if there's pressure points or other areas of concern, inflammation or pain, specifically offloading those issues, we can do that as well. But the foot is a complex dynamic functional device, so I always keep that in mind as far as, with orthotics, and it has to work with that patient and, certain accommodations that their bodies may have developed over the years. I'm not going too deep into alignment biomechanics. You guys are all well trained on this. I just threw in a couple slides on hindfoot and forefoot mechanics. My mentor, Dane, he was one of the pioneers on hindfoot mechanics, really emphasizing getting that, heel, the calcaneus, into neutral. Obviously there's some pictures here of the varus, higher supinated feet, and then on the left side of that bottom picture, a good example of a valgus hindfoot. So to me, that is important. Both that hindfoot alignment affects how that force is being translated through the foot, but also starts to affect up the chain from there as far as knee angle alignments, hip, and all the way up into the spine. And so, yeah, it's a big focus of mine, is balancing that hindfoot. That can make a big difference in people's experience. I have measurements on here. I know some people you guys take measurements, for, hindfoot alignment, or maybe even forefoot alignment. And I have some stuff on the order form for degrees of angle to change for posting and stuff. Typically, I haven't done that personally in my practice, but it is something that I think could be useful, and I've accommodated that for you guys on the order form. Again, forefoot alignment, same kind of concept, varus and valgus. I know you guys know this. Posting that for first ray or fifth, depending on the alignment of the forefoot. I know some people like to use first ray cutouts. I'm not sure. There's different philosophies around first ray cutouts. I'm happy we can do that into the design if that's something you guys like to do. I understand the concept. I usually don't do a lot of that, but it is something that I'm willing to, we can design that into the orthotic, or if we're going to discuss further, we can. I'm sure you guys understand that windlass mechanism of how, that plantar fascia has to gain tension in order to lock the midfoot to propel you forward through the gait cycle. That's kind of an important part of that forefoot alignment, right? Engaging that windlass mechanism. Looking at closed versus open chain, right? I think most people prefer the forefoot alignment. If you get that in a open chain, hold the hindfoot in neutral, and then looking at the forefoot, varus, or valgus alignment. It just helps you clue into what's functioning, what's happening with the foot. Again, dynamic functional movement is the key. So kind of looking at the big picture, putting all the pieces together to understand what your client or patient really needs is the key. So order process, super simple, right? You're going to assess the patient, do your normal assessment, whatever you guys are, doing, or looking at the orders from doctors, or gait analysis, standing, seated, however you guys, range of motion, all that, you guys are well trained in. And then making the foam impression. So that's going to be a big part of the process today. Will be understanding kind of how to do the foam box. There's a few things that are key to pay attention to. It's a pretty quick and easy process once you get it dialed in. It's not too complicated, but there are a few things that we want to make sure that we're hitting. And then filling out the order form. So the order form should have, here, go to it. You guys should have a copy. Try to make it pretty simple. Thank you, Cal, for helping me design this. It was helpful to get your feedback. But some simple check boxes for all the things. But normally we're going to, date, practitioner, location, pretty simple. Patient name, obviously, shoe size, weight. Sometimes helps me understand what's going on. That's optional. Age and weight you guys are designing them. That's sometimes helpful for feedback if you have any questions for me. And then obviously the sex or gender. for the shoe size, basically. So into the form, we'll just go over a little bit here now, and we can go over further later and answer questions. But there's top one, rigidity. So with the orthotics that I'm making, we're using a 3D printer. So we're gonna take a digital scan of the impression, design the orthotic on the CAD software, and then use the 3D printer to actually manufacture the orthotics. 3D printer has a lot of advantages for making orthotics. There's a lot of flexibility in the different styles and densities of the weave of how it creates the orthotic. And so for this first line, that's important because we can make them harder or softer through the arch, just depending on what you guys need for your patients. So that's where that rigidity, that's what that's referring to is, through the arch, how hard or soft. And I have some samples you guys can feel of the differences. So 3 check marks, try to make it simple. Standard, I have this kind of in the middle. These are all considered semi-rigid. The hard is getting pretty rigid, but I would still consider these all semi-rigid orthotics. Standard is in the middle, obviously. Soft feels pretty soft, and rigid is a little bit harder. And we can go over why or how you would determine which rigidity level you would like, but general rule of thumb, typically if it's a high arched or more supinated foot type, I like a softer device. You don't really need, you just kind of want to fill in, provide some shock absorption. We can add all the postings you want it to for hindfoot or forefoot postings. But generally in my experience, a supinated Pescavus foot type, people generally don't like rigid orthotics, and I don't think they're necessarily needed. So that's my general rule of thumb, but again, you guys can decide on your own. Standard is pretty standard. I think it's good for most people, even if we have a really pes planus foot and we're trying to bring up that medial arch. Standard usually works pretty well. Rigid, maybe when you need more support or someone's really overweight or very very flat, that might be good, but again, you'll have to figure that out for your patients and their needs. Cushion is the next category. So cushion just means this top coat material. There's backing on this material. This is basically like an ultra suede, so it's very durable. It has actually good feel for under the sock. But then there's different levels of cushioning that are attached to it. So the standard cushion is, generally standard, so that's what I would recommend for most people. It has some cushioning built in. It's about 1.5 millimeters, or it's about 1.5 millimeters thickness, but it gives a little bit more shock absorption. That's the standard. Thin would be just the fabric material with no cushion underneath, and then thick is a little double the thickness, so about 3 millimeters of cushion to provide a little more shock absorption. Fills a little bit more into the shoe if it's a bigger shoe, or if you want to eat up a little bit more volume in the shoe, that would be an option. Heel cup basically is the depth, right, of the heel cup. So on the CAD software, I have a lot of, I can do whatever I want, but I wanted to standardize things for you. So I have a standard heel cup, which I usually would use for most of my patients. Low heel cup would be kind of a lower profile. So for a lower volume shoe, maybe like a dress shoe or a flat or something where you don't want it to take as much volume in the shoe, you might want to use the lower heel cup with the thin cushioning. That will give you more volume to work with in the shoe. The standard with the standard profile, or the standard heel cup and the standard cushioning, I think is great for the majority of people with athletic type shoe. If you have a removable insole and you have a little room to work with, that usually I would stick with that most times, but we have flexibility as far as how deep you want to make this heel cup. Maybe like if sometimes I'm really trying to get somebody out of valgus hindfoot, putting a lot of posting there, strong arch, maybe build up a little bit more of a heel cup on the outside to hold the foot. The shoe does a lot of that too, so having obviously a good shoe to work with can be helpful in that regard. I always remember the shoe works in conjunction with the orthotic, so I didn't do a lot in this or anything about shoes in this presentation, but you guys are all familiar with different shoes and construction, methods of the shoe. So that can play a big part as well as how the orthotics are fitting and working. So just keep that in mind. The length, right? Full length is the standard, full length going, I like that because you have a removable, insole. You put the orthotic all the way down, doesn't move, you just solid into the shoe. But, for, again, like dress shoes or a shoe like a boot that doesn't have a removable insole or something where volume is a big problem or an issue that you're trying to, overcome, then the 3/4 is a good idea. I would probably go with the thinner, cushioning for that if volume is a big issue, but you can make a 3/4 orthotic with the lower profile, and the thin cushion works well for most dress shoes. I mean, not like a strappy heel, but flats or other more dressier shoes that don't have that removable insole. The 3/4 can be a good option for that. Normally this is, it's flexible through the forefoot. Obviously you want that to bend where the foot bends in the forefoot. So you're, providing cushion, filling into the shoe, but all the function of the orthotic, basically is through the arch and the hind and midfoot. So the 3/4 doesn't necessarily affect the function of the orthotic, but it just is more of a fitting into the shoe properly. Postings. Oh no, let's go to, we missed one. Arch profile. So this one is interesting. I mean, it's, sorry, let me go back. So the arch profile, I would standard most of the time. We have two categories. So the heel cup is back here, but arch profile, we can also make a higher profile through the arch, both medial or lateral. I would mostly stick with standard. That usually works pretty well. But if you wanted a higher arch for whatever reason coming up onto the arch a little bit more, we can accommodate for that. So that's a little checkbox for you. I think arch profile standard is pretty good though. You should probably, that would be 90%, 95% of what you're doing would be standard for the arch profile. So postings, again, hind foot, forefoot, little check boxes make it easy for you. Medial, lateral, obviously, and then under that, degrees or just standard posting. So if you guys are measuring, just put the degree on there. I can, to the degree, change the posting. Or standard is kind of like typically like 6 degrees is my standard for hind foot posting, or forefoot. That's my standard is like 6 degrees, but I'm happy to accommodate what you guys are doing that way. Same thing, forefoot's exactly the same, medial, lateral, degrees versus standard. You guys just see like a hind foot alignment issue. So I always like to check, closed chain, looking from behind, seeing the calcaneal alignment. So if you're seeing that, bow, hellbring sign, bowing of the Achilles, into a valgus position, you don't measure, or you just want a little posting there, you just put standard and I'll take care of it. If you're doing the measurements, like I said, just put the degrees in there and I can make that exact how you want it. Same on the forefoot, medial, lateral. And then modifications, I have a checkbox for some of the basic modifications that are typical. Met pad, obviously. I'll show you when we're doing the foam boxes, if we're doing it correctly and there's enough flexibility in the foot, we can actually capture a pretty good transverse arch in the foam. So for most people, unless you're trying to purposely offload some of the metatarsal heads, that should be enough for that transverse arch. But I can add, metatarsal pad very easily to the design. Metatarsal bar, same idea. I just build it right into the design. So if that's something that you need, just check that box. First rate cutout. So this one will be, I think I'll have to do something a little bit different with the orthotic. So first rate cutout, I think this might be more typical to what you've been used to. Probably what I would do is I would do like a 3/4 shell underneath with this first rate cutout, and then put the thicker top coating to fill all the way to the top. That way it's the same, you have that 3/4 length, support through the arch with the cutout so that first ray can drop down, kind of activate that windlass mechanism a little bit better. And then just take the material all the way to the top. unless you call for a 3/4 length, obviously, but typically that's how that one would look. I don't do a ton of those, but I'm happy if we want to talk about first rate cutouts. I'm happy to do that. And then heel cushioning, I put on there sometimes for, plantar fascial issues or other, where you want other issues where you just want a little more fat pad atrophy, something like that, where you want a little more cushion on the heel. Then I could just add that directly to the heel of the orthotic. And Morton's extension, also kind of a common one if you have any, first MTP joint issues and you want to kind of support that joint a little bit, whether it's arthritis or just some degeneration there. I have 2 levels of rigidity I have a really stiff one and then one that's, provides some spring and support, but allows for a little bit more movement there. In my experience, especially working with athletes, I don't typically like to, totally immobilize that big toe, but having a little support, giving a little bit of spring can be helpful as well. So those are all options. And then under the picture, a little section for written notes. So I put relief instructions. You can put that there if you want to, offload a met head specifically. We can create soft spots, in the orthotic, or create other offloading mechanisms to take pressure off of met heads or, lateral, sometimes the base of the metatarsal gets inflamed. We can do all kinds of combinations to offload bony structures or other areas of the foot. I think it'd just be easier to write that down though of what you wanted me to do. And then it's also, I did put a picture. It's helpful sometimes for me if you draw, with the written explanation of make a little picture of where you want that specifically, or sometimes that's helpful as well. So I wanted to give you guys kind of some standard options, but also give you enough flexibility to accommodate what your patients really need. It was good time. Any questions on the form at all that you guys might have right off the bat?
With those feet, is that looking from the bottom up or the top down?
That's from the bottom of the foot, right? So it's opposite, right? So this would be the right foot, this would be the left foot if the person was standing kind of this direction, right? Yeah.
I think it's worth it to mention that Jonathan has simplified kind of his capabilities significantly with this to kind of standardize it, make it simple, easier for us to kind of get into it. But he's reinforced that he has, with me at least, that he has a ton of capabilities beyond just what you see here. And if anyone has questions throughout the whole process with ordering, I mean, he's got his contact information right there. He's been very accessible to me going back and forth. And I know that he will be with you. Email, what's the best way? Is it email?
I would start with an email probably. If you have a question, just shoot me an email. If it's clear and I'm just like, got it, I'll send you a reply. Otherwise, maybe a little quick conversation on the phone if it's not exactly clear. That's my cell number on there too. So, I'm happy to be available for you guys if you have questions, either during the ordering process, the evaluation process. If you get the orthotic and you have questions or concerns or there's some issue, just reach out to me and I'll get back to you within the day. I'm easy to get hold of. I want this to work for everybody really well, so I'm excited to be here. I'm excited to partner with you guys. And this is a big deal for me. I'd love to, I actually know Dr. Ferguson pretty well. I worked with him for many years, and I know you guys are a great group of therapists, so I'm really excited to do this, and so I'm happy to take any questions or concerns, and it's easy to get a hold of me. And I'm right here. I'm right actually down the block, so my office is in Shorewood, where I see patients. So.
Can you do reverse Morton's extensions too?
Yeah, we can do whatever you want.
Okay.
Yeah, just make a little note.
And then with the rigidity, so the person we currently work with, a lot of times if we want something softer, then it gets really bulky in the shoe.
I have nope.
Okay.
Doesn't. So basically, everything is this. It'll look the same. It's how the 3D printer weaves the density of the arch, and so it doesn't. This is one big advantage because volume before. So I've been doing it for 12 years. My old school would be we would take a foam impression, make a plaster mold out of that, and I would use kind of cork or EVA foam as the orthotic. and they're just bulky. They just take up space in the shoe, and so that would be honestly my number one complaint all the time. Be like, it doesn't fit in my shoe, or it doesn't fit in this shoe. And I had other options. I had a dress orthotic option. It wasn't as good, but it would accommodate for shoe volume. So I'm really excited with the 3D printer. There's so much you can do with the design and keep the volume, minimal. So it fits great in the shoe. It doesn't eat up space like that. So.
I have samples here of 3 different densities that he offers, and they're labeled on the back, so I can pass these around, and I'm sure you'll see them with what he has as well.
Yeah.
So we send those around now, or do you want to wait?
Let's just wait. We'll do it at the end, man. Unless
send-
you want to.
Can I send
Yeah.
these around?
Yeah, send them around.
These are
Yeah.
kind of cool. So send these around. It's perfect. Thanks
Yeah,
for the
just keep them
question.
together.
Keep them together so you can feel the difference.
But I have other ones too. I have all 3 here too. So, and it's a pretty big difference, honestly. If you go from the soft to the hard, it's not a small amount of a difference between the rigidity levels.
Lengthwise,
Yeah.
if you were to order a full length with the material that they're made out of, are they trimmable?
Yep.
I mean, so we could make them into a 3/4 length if we chose to down the line?
You could, yes. Like, 2 things. One, yeah, sometimes like if you need to just trim a little bit to fit in the shoe perfectly. There's all kinds of different shoe shapes, right? 4-foot shapes, right? And so I tend to err on the side of trying to make them a little bit bigger so that they're not short in the shoe, because you don't want to feel the edge on your toes, obviously, or have it move in there too much. But yeah, just the scissors. You can take a good quality scissors. You can trim this. The one thing I think if you're making it 3/4, it's gonna be like it's gonna leave like a.
So it doesn't taper down
Yeah.
if you cut it down?
Yeah,
to the-
like if I get it from the sheet as 3/4, it'll just print it like it'll skive it down
Got
to
it.
thin it out. Versus if you trim it, it'll just be like a hard edge there.
Yeah.
Probably wouldn't feel real great, to be honest, but you could.
Okay.
Yeah, I would say if someone likes them, but they're they need a specific one for a smaller volume shoe or something, I would just order the 3/4 if they like them.
Do you tend to do a low heel cup with athlete shoes as far as a soccer shoe, a baseball shoe?
Yes, definitely. For cleats, that's like my perfect opportunity to use the lower profile, lower heel cup, the thinner top coat material. So yeah, that's a big issue with all the Marquette athletes I work with lacrosse and soccer. And they like the tight little cleats too. So there's not a lot of space. Although a lot of them now at least they have something that comes out of the cleats most of the time, and so you can still go full length, but you just want to make it probably that thinner top coat with a lower lower heel cup, so it sits a little bit better in the shoe. Yeah, good question.
The shell, you have the 3/4, is that, because sometimes I'll do like sulcus versus MPJ, like what is
So I would say my standard is the sulcus. That is kind of what I would do for a standard 3/4. But if you wanted, more ball of the foot, kind of where a Met bar would end, then I would just write that in the notes. I can do that for sure. But typically I'll go to the sulcus.
And then cutouts, you said, just to put a note for it, like if you wanna Sharpie the spot to have it go onto the cast, I'm assuming it'll go into those casts too?
Yes. So Sharpie would work. You could also just take like a pen, like click so that the ink part isn't sticking out, and just make a little mark in the foam. That could work too. Or you could write. I've never Sharpied on there, but I'm sure it'd probably take
Right,
a
like
Sharpie.
Sharpie the foot actually, and then the foot goes on.
Oh, onto the.
Yeah. Like I would Sharpie the spot, and then if the cast picks it up.
I've never tried. You could try. Like I'm not sure if that would if it would stick on the foam or not. Worst case scenario, if it didn't, then you could see where those structures are pretty easy in the foam. Like once you press down and you take it out, it's very clear where all the met heads are, where all those bony structures are, and you could just make it onto that foam. Yeah.
So when Cal City has 3 right now, does that mean that there's just 3 choices of rigidity for the shell, or?
I kept it simple. Yeah. For that.
There's a lot.
There's like 5.
Oh.
But the difference between, so if you had 1 through 5, the difference between 1 and 3 is not as great. You know what I mean? It's kind of a smaller difference. So I just wanted to simplify it for you guys. I mean, you could, if you're really specific and want to you can make a note for me, be like a little harder than softer, you know, or something. Like, let me know. But honestly, like, if you see when they come around, like, those should be pretty good for most you know, situations.
I was just curious on what are your athletes looking for out of the soles?
So it depends. Like at Marquette, they usually have a problem, right? I mean, basketball, we have done some for just preventative, like screenings, like looking at foot mechanics, and trying to stay ahead of things a little bit. So then that's where I'm doing my exam, looking at the foot, mobility, range of motion, open chain, closed chain, all that stuff. Trying to assess, like, well, what are the potential, you know, issues that might develop? And, you know, with that amount of impact on your feet, we do like to be a little bit preventative. But typically, it's like if someone's having some symptoms or some problem, whether it's, you know, foot specific, ankle specific, shin splints, knee issues, you know, even up to IT band, you know, SI joint, it's all affected from obviously the mechanics of your foot. Once that foot hits the ground and those forces get changed and angles of joints get changed, it's going to start affecting things up from there. So typically though, it's, you know, even with the Brewers, I've been pushing them to be more preventative, but I haven't gotten there yet. They just call me when they need something. But does that answer your question?
Yeah, for sure.
Okay.
I'm trying to picture what goes into this 3D printer. I mean, are you putting like a sheet of plastic?
Oh,
that
I've
goes
got
in
some
there?
pictures for you.
Okay.
Yeah.
All right.
We're not there. I'm not completely done.
All right.
Yeah, we're gonna get into the technology in a second.
Okay.
Good question, though. Good
Thank
question.
you.
Yeah.
Okay.
We're almost there.
Mhm.
Yeah.
For your arch profile for the increased, because I'll do like a P-wing, which is called in our current lab right now, where for someone that's spilling over, you know, so much, then they get like a rubbing on that medial end of the arch.
Mm-hmm.
So when you say increased, do you use like the cushion and your top cover to make like a lip on the top, or how do you do that?
So you mean like on the profile of this medial arch,
Like to make the medial arch elevated so they can't just spill over and rub on the top. Like someone that's like not an athlete, this is like a pancake.
Yeah.
foot.
Yeah. I honestly, I mean, the 3D material gets super thin at the edge, and so that doesn't really, like, it's not irritant into the foot. I would just bring the whole thing up.
But that's what I'm asking, is you bring the shell up
Yes.
with the top cover
Yes.
and the top, okay.
Yes.
Alright,
Yes.
good to see that, I must be, yeah.
Yeah, I'm sorry, I didn't have a great example. This one is a little bit hot. I'll give you these two. This is kind of a low profile with the
Come
thick
up,
coat.
like, really high.
Yeah, this is a little bit higher than kind of what my standard would be. But
Could it come up even?
oh yeah, I mean, with the 3D
Yeah.
printer, so we can accommodate that.
Yeah,
And if it is something where if you just want that top coat material up without there, I mean, I could do
without the
that.
shell.
Like,
it's been effective for these people that,
yeah, just to kind of give a little more cushion
Yeah.
there. Then,
Yeah.
I mean, yeah, I can do that.
Okay.
If you make a note for me, that's fine. I wouldn't say that would be standard, but like I can do that. Anything else? Okay. So foam impression. We're gonna get into this. There's a few things that are important, and it's not that hard, but there's a couple tricky things that I want to get enough practice, at least with everybody, as far as demos and some samples for everyone to try to do it. I guess we don't have enough boxes, but we do have a lot of foam, so we're gonna use the foam, I think, without the boxes, and it should be fine for practice purposes, just to get the mechanics of what you guys are doing down. Should be no problem. For the patient, I always have them seated, so I do, semi-weight bearing in a seated position, usually on the edge of the chair, good posture, nice and upright through their spine, and gaze straight ahead with the hips and knees at a 90 degree angle. And so sometimes that's a little tricky as far as the hip angle. If you have a high-low, that's what I use at Marquette. I'll just use the high-low and just like move it up and down, have them sit on the edge to get the right positioning. If you just have like a chair, it could work, but if someone's really tall, really short, it changes it. But if everybody has high-lows, then that's really easy. You can just sit on the edge and adjust the table. So for the so that's the patient sitting at the edge, nice posture, 90-90. For you guys, you're going to be kneeling kind of in front of the person. You're going to place their foot, have them lift up, whatever left or right you start with. I always start on the left, but it doesn't matter. Have place the foam just gently kind of on the middle of the foam. Gonna feel in with the thumb and finger into the subtalar joint. I know you guys, if you're doing that already, in a prone position, that should be pretty easy for you. Find that subtalar joint, can externally, internally rotate so you feel the head of the talus is kind of centrated there in the joint. And then you're gonna manipulate a little. If someone's really collapsed, you external, internal rotate, find that kind of medium of the subtalar joint, but then you're gonna have to try to like lift up that foot a little bit to get it really into neutral and hold that while you're pressing down. Takes a little bit of practice. It's not too hard to do. Basically, you're going to hold it with one hand on the bottom while your other hand is on the knee and just pressing the whole thing down into the foam. Then you're going to make sure to get the first and the fifth met heads down to that same level as the heel. So basically, you're just going to crush down the heel down to the bottom, get the first and the fifth met heads down to that same level, and that should capture a good arch in that subtalar neutral position. Again, we're gonna have enough practice, I think, today to feel confident in this. So some of the potential issues that I've run into in the past with other clients, getting the hand in the foam, and especially if you're really trying to like get that navicular up and you're kind of holding, it's a little bit of practice so that you're not pressing into the foam with your thumb. If it's a little bit, it's fine, but like you don't want to crush into the foam with your hand too much. Not getting all the way down to the ground, that's kind of the more common thing where you're maybe you didn't press that first one down all the way, so it's kind of raising that first ray or the fifth. So basically you're on a nice, nice level tripod for the heel, and the first and the fifth met heads all down to the same level. And then we can add the postings afterwards. But if you start level, that gives us a good starting point. Sometimes if you get the arch too close to the side, it's not great. Or I would do this on occasion. You get the heel too close to the back. You need a little bit of space, from the heel to the back of the box. Those are the most common errors or issues that I've had in the past. So here is our process. We have wait, that's not the best picture. So I got a better picture for you. But we're gonna scan the impression with that black box is the 3D scanner. So then we design the orthotic on the CAD program, based on the actual arch height and foot dynamics, and your notes from the lab order form, and then print them out on the 3D printer, and then I add the top coat based on your cushion level that you want. So it shows this is the scanner. So basically, it's a 3D laser scanner. It's accurate to the millimeter. That's kind of how the image turns out from the foam box, and then we can you basically import that image onto the template, which is this one on the design CADware. So the CAD software, get all the exact measurements from the foam box onto the software, and then I can. This one's weird. You can see how weird. This was kind of incomplete design, I think. So you guys see that weird profile on the medial arch or the super high heel cup. I mean, that's all. Super adjustable depending on what you guys want. So it's a lot of flexibility. And then that's the printer. So it's just pretty simple. The actual mechanism is not that complicated. Where you just take the filament, is that TPU, so it stands for whatever that plastic filament is that they make this, and it heats it up onto this little nozzle, and then it has the 3 planes of movement on the machine where it just kind of melts out that plastic into the form that we designed, and it's ready to go. We're ready for top coat at least. And that was basically what I had from the slideshow. You got any more questions on technology or order form?
How expensive is this plastic? I mean, is it inexpensive?
The material itself?
Yeah.
Yeah, it's not very expensive. I mean, it's a very specific type because technically you could use it without a top coat, so you need specific plastics in order to interface with, skin. Certain materials aren't going to be good for that, so it is designed for that. I always put it. It just finishes it, and it's a lot nicer experience with the foot if you have a top coat. But I mean, it's not very expensive. The material.
We have orthotics made. What's the process if it's like, oh, that's not working well? Do we get in touch with you?
Yeah.
Kind of, is there other modifications that can happen, that sort of thing?
Yeah. So yes, that would be the case. You would, if you're having some issues and because there's not a ton that you could probably do in your office to adjust the orthotic after it's made, aside from like trimming that. I mean, you could add things to it if you're sticking, I don't know, you could, people will glue or tape on different things just kind of as a temporary measure maybe. But no, yeah, you contact me, let me know what the problem is, and then I should be able to find a solution. Like I, in my practice, don't get a ton back on these. Like, I don't do a lot of adjustments on these. I've been really happy, actually. I just, basically, people call me and order more is most of the time. But if it's a very specific thing, then yeah, I would remake one for you if we needed to do that. Like, say it's either too rigid, it doesn't fit properly, it's not comfortable in certain ways. If you can understand what the problem is and help guide me on how to correct it or how to change the design to accommodate them better, I'm happy to do that. I hope that we don't have to do that a ton, but my commitment has always been to make things work for people. So literally in the 12 years I've done this, I think I've had 2 or 3 like failures where they were just like gave up and like forget it. Not after a lot of work trying to fix it. So yeah, my objective and my commitment is making it work. So if you guys have any problems, I'm easy to get a hold of, and it's it's not that hard to tweak the design to accommodate things that maybe aren't feeling great for that patient. Yeah. What are some of the common issues that you've had in the past with that?
I don't usually do orthotics myself, but I know just from other people, just get it back and the fit isn't right or such and such, that there's not as much that we can do, and then it's okay sending back or getting it remade, that sort of thing.
Yeah. So if it's on, so I haven't talked to Cal about this too much, but if it's on me, like the design doesn't fit well, the shape is wrong or something, like, yeah, I'll just redo it. You just let me know, like, well, it's too short, or it's too wide, or it's too narrow, and then I'll fix it on design, make a new one, and send it to you. If it's something more of like, I just can't get used to the arch, if it's just uncomfortable because it feels like a lot of pressure in there, and we'll have to talk. I don't know like how.
We'll figure it out.
Yeah, we'll figure that out. But I'll make it work. One or the other, I'll definitely make it work. I just, if it's on me, I'll literally just do it for just print out another one quickly and get it to you guys. If it's on the design side, then we'll have to figure out something. Is that fair? Okay.
So I know that many of you have time commitments back at the clinic. So let's see if we can get into the lab components.
Great.
And would you want to do a demonstration of the casting?
Yeah, that's definitely the first step.
The impressions?
Yeah.
Okay.
Let's do it.
I'll let you take it away. Maybe I think this right here at this bench maybe
Sure.
a good thing to do.
Who wants to be my guinea pig? All right.
Let's do this. Let's do a Jonathan can do a demonstration of